Also commits to the publication of a report on the hospital network consultation, and I'll just turn briefly to that next, Chair. So the consultation involved 9 separate events, and people and organizations could also complete the online questionnaire or submit standalone written responses. We received around 30,000 responses, so a really significant response to that, with the majority from the Save Our Acute Services campaign group, around 28,000 or nearly 28,000 responses. Responses originated from citizens, a range of organizations and campaign groups.
In terms of the Southwest Acute Hospital, we have a situation where we have a hospital network consultation which talks about the Southwest Acute as being a general hospital. We have a consultation from the Western Trust about closing emergency surgery at the Southwest Acute Hospital. And we have an intervention from the Minister in July via the local press. Quite why it wasn't put out via the department, I don't know, which says the Western Trust must bring forward a sustainability plan for the hospital. Now that in itself is welcome. That's not an issue. That's welcome. How do those 3 things interact? And which will come first? The hospital network consultation, the Western Trust consultation, or the Minister's sustainability programme? So you understand why people in the southwest of Northern Ireland are confused by what's happening, and they're very, very angry.
I want to hug a couple of minutes. So, I mean, obviously 28,000, as you are attributing to the SWAH campaign, which, I mean, fair enough, they will have led the campaign, but they had to get 28,000 individuals to respond, so that in itself does send out a strong message about the strength of feeling.
We're not telling them how life will be better, how their access to healthcare will be improved. We're doing this blind and in the dark. Do you understand now why you got 28,000 responses to the consultation from the Southwest?
Oh. In terms of the response that your department has had of 30,000, I assume that is extreme numbers, or is in the grand scheme of health consultations.
It's the most I know of. But
it's the most.
We're not sure if it's the most in just the Department of Health or the most across all departments. We haven't, not quite sure, but it's definitely up there.
Our friends in SWAH contributed heavily to that, so you know.
I get that, but there was a couple of thousand others beyond SWAH, which again is an extreme number.
The couple of thousand
that's usual.
Wouldn't be.
Okay, so Glenn, that, you know, how then the feedback from the consultation, how will that directly influence the proposed transformation plans, or will it at all, or have those people responded effectively? So, and what?
Well,
I don't like maybe just some of the commentary that there is, because regarding the previous things that have happened and not being considered, and it builds a bit on what Diana said, because we have been consistent along the time saying that we are up for transformation, but transformation means looking at the whole system. And if during that process of, you know, transformation, for want of a better term, if you're rearranging the chairs as to where the services are, it felt a bit odd that there were chairs being taken off the platform, such as Causeways Maternity, such as the emergency service in the SWAH, much as the emergency department in the Down. These services, and Daisy Hill as well, they were being removed before we looked to see what chairs are there to be able to reconfigure them, and we've always felt that that was a wrong way. I actually feel it's not from yourselves, but I think that process is a bit underhand because those services are being taken out of a community, and then we're looking at the overall system and saying, well, that service isn't there anymore, so it can't even be considered as part of the way going forward. And I think that really has upset a lot of people in the community, and that's why there have been so many responses. But just a final note as well, the Southwest Acute, the Down Hospital, the maternity services at the Causeway, and the issues in the Daisy Hill. I made this point in the House the other night, all rural. Please go back down to that department and shout that the rural community deserve services as well.
You said most reconfiguration will be taken forward by the trusts. Yeah. So which decisions are going to be the Minister's decisions and which decisions are the trust decisions?
Okay, so any reconfiguration decision that the trust make, they will make it. If it's major and controversial, it'll go to the department for basically an endorsement or not.
Which is likely to be the vast
many of these will be major and controversial, I would suggest. Certainly controversial.
Will not be taken forward by the trust, it will be the Minister.
The trust will take the decision, the trust board will take the decision. They'll submit that decision to the department alongside a consultation report, all the evidence they have. The process is that goes to SPPG in the department. They will review that. They'll take advice from the PHA from a public health perspective. They'll take advice from the department's policy side that links in with that. And all that will then go in a submission to the Minister with a recommendation either to agree or not. And if the Minister turns it down, it's back to the trust to come back with a revised proposal. So that's kind of the process.
Western Trust can take a decision in relation to emergency general surgery. Who says yes or no to that decision in the department?
Well, that's according to the guidance that is for the department to determine. But I think this is major.
Who says yes or no?
Major and controversial. That will be the Minister, to my mind.
Well, we know it's going to be controversial.
Yeah.
So it will be the Minister at the end of the day that says whether emergency general surgery or emergency surgery continues or is restored or not.
He will say yes or no to that decision.
He will say yes or no. Oh, thank you for that clarification.
Could we ask for some sort of breakdown in the classification of the responses to that document? Because I would really want to say I think this will be an excellent example for us. If 30,000 people have responded to this consultation, how much of what they say will be taken into consideration? And I think that this will set a very clear benchmark for full executive-based consultations going forward. If 30,000 people say something and there's no change of it, and 28,000 of them are on the one issue, then I'm sorry, consultations are not worth the paper that they're written on, because they're not listening to the people that they're consulting. So if we...
On the consultation document, that it didn't maybe go as far, didn't contain the detail that people expected, it was kicking the can down. We need to ensure that it's best used. So anyway, something that I hope you can answer, hospital reconfiguration.
Yes.
So there was probably a lot of criticism at the time on the consultation document that it didn't maybe go as far, didn't contain the detail that people expected, it was kicking the can down the road. But even withstanding that, 30,000 responses, I think you said 29,000 of them from SWAH probably, within the Western Trust in relation to the Southwest. So there was a debate in the chamber the other day. The Minister, I listened to the debate, wasn't able to stay, but I know Dan and Colin and everybody else asked questions. The Minister didn't really answer any of them, to be truthful, and everybody else will probably outline that. So in terms of the Western Trust decision in relation to general surgery, there's a configuration of that with all these other consultations and strategies. How will it all tie to hospital reconfiguration? Because the Irish News did a piece today saying the Minister's given a commitment to the Southwest Acute, but I don't think anybody thought that was in jeopardy. What is in jeopardy is the actual services that are contained within the Southwest Acute. So, how does all of this reconfiguration work, and when will the Minister and the Department have a view on that?
Okay, so there are a lot of issues in that, obviously. So the consultation, as you're right, it didn't actually commit to any specific reconfigurations. It was more about a network of hospitals collaborating to try and deliver better outcomes, and we gave examples of how that's already happening. And we basically were saying we need to do more of that to deliver best services for people. It was meant to give a framework for specific reconfiguration decisions, such as the one in Western Trust. So that was the purpose of that document. The Western Trust consideration of that specific service can go ahead regardless of the outcome of the consultation, to my mind. It's not contingent on that, because actually the hospital reconfiguration document didn't say anything about general emergency surgery in Western Trust, actually.
It was lacking in detail
Yes,
across the board.
Yeah. So therefore Western Trust can go ahead with that consultation and take a decision in line with the guidance that we have on that.
Okay, I'm sure everybody else is going to ask.
I didn't answer the question about timescale. So we are obviously working up a final draft report, which we think, Michelle, still we get to Minister before the end of this month. That's what the timescale we're working to. So a couple of weeks away, Minister will then grade and we'll get it published, and they'll set out a response.
A couple of minutes. So, obviously 28,000, as you are attributing to the SWAH campaign, which, fair enough, they will have led the campaign, but they had to get 28,000 individuals to respond, so that in itself does send out a strong message about the strength of feeling with regard